This Week in Virology, the podcast about viruses, the kind that make you sick.
So hello there, I'm Rich Condit with Microbe TV, and I'm in Chicago at the Hepatitis B virus international meeting. It's the International HBV meeting, and I'm here with one of the participants, one of the speakers at the meeting, Thomas Tu from the Westmead Institute for Medical Research in Sydney. Did I get that right?
All correct. Yep,
where he's
great.
An associate professor. And we're going to just have a little chat about his background and his interests and a little bit about hepatitis B virus. So, Thomas, welcome.
Thank you. Great to be here. Thanks for inviting me.
Right. So let's start at the very beginning. You're a native Australian, is that right?
Indeed.
Okay. And how did you get interested in science and in general and HBV in particular?
Yeah, so I come from a migrant family, so my parents were always pushing me to be a doctor or lawyer or something like that. So I chose doctor. But the thing is, my high school grades weren't good enough, so I got into biomedical science, hoping that I could maybe move into medicine later. But by second year, I thought, why not stay in this? Because actually, when I was 15, I was actually diagnosed with hepatitis B myself, and found out that the University of Adelaide, where I was doing my studies, actually had one of the only research units dedicated to HepB there. And so I, from second year onwards, sort of aimed towards that. I did my honours year there, then a PhD, followed by a postdoc in Sydney, working on liver damage and inflammation, followed by a second postdoc with Stefan Urban, who I understand you've just had a conversation with. Yeah, so I stayed with him for about 4 or 5 years, then returned to Sydney.
Was that in Heidelberg?
It was in Heidelberg. Okay. Beautiful city.
Okay.
I don't know if you covered that.
We didn't talk about Heidelberg itself, but I've been there, and it is a beautiful city.
Oh, it remained beautiful even 4 years after. I mean, just amazing.
Okay.
Amazing research as well, of course, as you know.
So that's your only venture out of country during your training as the Heidelberg postdoc?
Exactly.
Okay.
Yeah. Then I came back to Sydney, where I co-lead a group in viral hepatitis pathogenesis, mostly in B. So I co-lead with a infectious diseases specialist. So he does Professor Mark Douglas, who does the clinical side. I do the wet lab side, and it's a real nice collaboration because it means we keep that real connection with the clinical aspects and make sure that what we find in the lab actually applies to something in people.
Excellent.
Because we know of a whole bunch of lab artifacts that in the end mean nothing. We want to make sure that what work we do in the lab makes a difference.
So it's a good thing that you didn't make the grade to medical school. Right?
Yes, I'm perfect in my imperfection.
I was like most undergraduates interested in biological science, I was briefly interested in pre-med, and I realize in retrospect, I would have been a terrible doctor.
Myself included. Yeah, me too. When I see my colleague go to the clinic and just be so overwhelmed with all that's involved with clinical work, I'm glad I'm in the lab.
And yet being in a medical environment for the kind of work you're doing is great.
Yeah, exactly.
So I want to sort of spend a little bit of time. I'd like to get further into your research in a minute, but I'd like to back off a minute and talk about your experience with the virus itself. You said you were diagnosed when you were 15.
Yes.
And how long before you actually started working on HBV was that? Just out of curiosity.
Man, that would have been 8 years before.
8 years.
Yeah,
so
yeah.
you started when you were about 23.
So actually, right after I was diagnosed, it's quite an emotional experience. You're being told that you have this condition that you'll have for the rest of your life because Hep B is currently incurable, and it causes cancer.
Did you understand all of that at the time you were diagnosed?
Absolutely not, actually.
Okay.
The main thing that came through was you have this forever, and undertones of it's shameful. Because it is classed as a sexually transmitted disease or always linked to those sorts of things, that's something that, particularly for someone who's from a migrant background, where you just want to integrate because there's a whole bunch of things against you already in that community. You just want to fit in, head down, work hard, and that's all you want to do. This thing sets you apart from the rest of society. So you just wanted to be silent about it, head down, not tell anyone. And so being diagnosed with hepatitis B was incredibly isolating. You didn't know anyone else with Hep B. Even though we know that 300 million people around the world have a chronic infection. In that context, feeling alone is completely crazy, but it's what people go through every day.
So you did keep it to yourself?
Yes.
Your family must have known.
Yeah, sure.
Okay.
And so the majority of transmission of hepatitis B goes from mother to child. And indeed, my mother has it and was the one who probably transmitted it to me. And, she must have gone through a whole lot of guilt from that. In fact, one of the most, emotionally devastating points for me was her just coming up to me and saying, Mummy is sorry. Terrible. And so, yeah, there's so much impact of hepatitis B that we as in a scientific role you probably don't see, but we're trying, myself included, trying to bring those impacts across, if only just to motivate people to work in the field.
So she probably didn't know that she was chronically infected until you were diagnosed, correct?
It may have been that way, yeah.
So after you were diagnosed, did that information motivate her to get tested, or how did that work out?
It was all part of a family sort of thing, and indeed, hepatitis B runs in families,
Okay.
There are different understandings of hepatitis B around the world. Some people think of it as an almost generational curse. It's just the way people understand disease around the world is not necessarily in DNA, RNA, proteins, and all this sort of thing. We only understand it in the ways we can get at it, right?
So why were you tested?
The testing of hepatitis B comes a more risk-based testing. So one of the risks that are associated with hepatitis B is coming from high prevalence countries.
Okay.
Places so the Southeast Asia, Asia Pacific region is home to the most cases of hepatitis B in the world. So people from China, people from Vietnam have a high rate of hepatitis, and so it's contingent on people from those communities to get tested. There have been changes, particularly in the CDC recently, that everyone should know their status, whether they are infected, whether they're vaccinated against hepatitis B, and therefore protected against any further transmission. And so this makes it a less stigmatizing condition. So we don't want it to be like, oh, people are bringing this in from outside the country. It's already everywhere. Everyone is at risk, except if you're vaccinated. You are protected. So it's contingent on everyone to take care of their health.
So you can have a chronic infection that's asymptomatic.
Yes.
Long term, right?
Definitely.
So has your mother ever had any symptoms?
She has, because she's a bit older. It actually damages your liver over time, and even that damage can be asymptomatic.
Okay.
So essentially from when you're born and infected to maybe when you're 30, 40 years old, there's actually no liver damage. Hep B is a non-cytopathic virus. It generates a whole lot of virions in the blood, 10 to the 9 per mil. And it happily goes along with that, and you have no symptoms. Over time, the immune system recognizes the infected cells and tries to get rid of it. The virus persists, and we have a case of chronic inflammation. Okay. Even with that can be asymptomatic. So
have you ever been symptomatic?
I have not been symptomatic except one time where there was probably a flare of ALTs and liver damage. I did feel a bit run down, but this was during a time when I'm being monitored all the time in terms of every 6 months I have blood tests to look up my liver health. Liver function test, sorry. And so I keep an eye out on whether my liver is damaged or not. And that's the only reason.
And you're taking antivirals.
I am taking antivirals.
Right. And that's indefinitely.
As far as we know, until we come up with a cure.
Until you come up with a cure. Now, it's my sense, you talked about transmission that's maternal to the baby.
Correct.
I asked this question today, but I want to be clear. That can the fetus be infected, or is it primarily during birth?
So as far as we know, it's probably during birth.
Okay.
As if you're vaccinated as a newborn, as in within hours of birth, you are protected against hepatitis B.
That's amazing.
So we don't know the reason. There probably isn't exchange of the virus, and even if there was, the fetal liver is probably not entirely susceptible because it doesn't maybe express the NTCP as well. Okay. So you may have some time with that.
Actually, is nursing an issue?
Nursing is not an issue. So the WHO recommends that mothers, even if they're positive for hepatitis B, keep going on breastfeeding because it is risk-based analysis means that it's much more beneficial for the baby than not.
So aside from the maternal transmission and IV drug use, which we can avoid, okay, it strikes me that it's not incredibly transmissible.
Yeah, well, I guess it depends what you're doing. I mean, things like tattooing, things like going in for surgery, and I mean, there have been cases of transmission during dental surgery in just slip-ups.
Where there's blood involved.
Yeah, exactly. Okay. So, I mean, it could happen to anyone. So that means it really is contingent on everyone to be vaccinated, get tested, know your status, and if you are Hep B positive, it really isn't the end of the world. You can live a healthy and normal life if you're under monitoring. It's a condition that can be right. So I wanted to get that message out there.
So you were diagnosed when you were 15.
Yes.
When did you, shall we say, come out?
I came out, yeah. That's an interesting story. So here at the International HepB meeting, maybe 5 years ago, 2019, we actually started what was the community forum. So this was actually the scientists and the Hepatitis B Foundation coming together and making sure that we're making a difference with patients, with the affected community. So we actually ran a forum specifically for that. So we brought in patients, we brought in the scientists to listen to these stories. And it's on that stage that I actually came out and publicized my status to my peers. And that was infinitely more scary than any scientific presentation that I had to do at that conference.
Was it a relief?
It was a relief because I was met with such positive positive vibes and accepting from everyone.
Probably one of the safest environments to come out in.
Yeah, exactly. And I think it really brought it home for everyone in the crowd that, oh, this isn't a disease that's out there.
Right. It's right here.
It's right here in the room, watching, what you're doing. And I think it made everyone just rethink, am I doing right by the community? And just being able to push the needle a bit in that respect for me was incredibly rewarding. And after that, so that was not only coming out to my peers there, but it was also linked with some news articles, and I was on a live radio interview about it. So it was an intense time.
Right,
It went from 0 to 100 right away. But straight after, I had people ringing me up saying, I have Hep B. I've never told anyone. I've never heard of anyone else having Hep B. I just wanted to say thanks, or I just wanted to say, I just wanted to get that off my chest. And I was getting individual emails and phone calls, and I thought, I'm honored and pleased, but I also can't. I want to spread that even more. So I started up an online forum for people with hepatitis B called HepBcommunity.org, where we not only have this platform where people can, be open and share their stories and how they navigate the condition, but also bring scientists in and clinicians in to not only see these stories and the impacts, but also provide their expertise directly to the community so that their knowledge really now has much more impact. So you might not feel that impact when you're pipetting clear liquids into other clear liquids in the lab, but here you can immediately see the impact of your words and your expertise. And that has really been rewarding for a lot of people in the community.
So your laboratory now, what's your main focus? Yeah,
so having hepatitis B myself and reading all of these stories, I feel like there are two main sort of anxieties about hepatitis B and the main impacts. So one is the persistence of the virus, so how hepatitis B persists in the liver over the entire lifetime of someone. Yeah. So if we know the mechanisms around that, we can sort of reverse engineer and try to develop a cure, right? The other thing is determining how hepatitis B causes cancer. So there's a form of the virus that integrates into the host genome. And we know that happens really early on in the initial infection. So when you're born and get infected, integration occurs straight away. Now, it only occurs in maybe 1 in 10,000 cells in the liver cell population. But when we look in cancers that occur maybe 50, 60, 70 years later, they're full of integrations. And we don't understand at the moment what happens at the start of infection that that when that integration occurs and what happens during those decades of infection that lead to that cancer. And that's what I'm trying to figure out, the molecular mechanisms.
So it sounds to me as if the work that's ongoing is what excites you for the future. They're one and the same, right?
Yeah, exactly. I mean, the integration of everything, the patient voice, the molecular stuff, the clinical stuff that we're also doing, making sure that whatever we find in the lab means that it's something that actually occurs in people as well. So we look at clinical samples as well and looking to make sure that our observations match the actual.
I really like that model. Integration of the. Yeah, there are a lot of people who are physicians, scientists, and try and do both. Yeah. I think it's better if you have a physician and a scientist in a way.
Definitely.
It's, both of those are more than a full-time job.
Yeah. Actually, I'm spreading myself because I'm actually also doing some community research, some social science using the forum. So this allows us to understand, what issues is the community facing? How can we improve care in these sorts of areas? What's stopping people from, getting monitoring, getting treatment, all of these sorts of things.
Did you ever see yourself, you're basically an activist.
Yeah, definitely.
Did you ever see yourself in that role or it just happened?
I think it just happens. And when you get passionate about something and when you see something not right, I think the natural intention for some people is run towards that and sort of make a difference. And it's mostly because I benefited from other people being that activist. I decided to, publicize my status because I saw one of my colleagues, Dr. Sue Wong, come out as well. And when she did that, that was like a weight of my chest. And I thought, if I can do that for someone else, why not? I'm in, as you said, the safest sort of community to be able to do that. And if I can, I should. And that's why I sort of do what I do.
So where do you see this all, yourself and et cetera, say 10, 15 years from now?
Oh, I don't know. Hopefully still doing the same sort of thing because, the HepB research field, as many people as it affects, I feel is still underfunded. For example, if we just compare it to HIV gets maybe 10 to 100 times more funding, R&D funding. HepB affects 10 times more people. So the disparities between what gets funded and what's affecting people is still quite inequitable. I'm not saying we shouldn't fund HIV research. They definitely need it. Everyone needs it though. And Hep B in particular.
You know what? There's plenty of money around.
We just
have to spend it right.
Exactly. But some of that activism needs to be there to force those funds to come here. And if I can be a catalyst for that, it can't be me alone. But if I can be that bridge for people to feel confident enough to come to the table, put my hand up and say, yes, I want to be involved. We need to get that wave happening. It happened for HIV as the gay rights movement and all of that movement was happening. HIV was one of the central issues. We've got to make that same fire, that same pressure, that same passion to come out for Hep B. And that's what I'm trying to do, as well as, cure it and all that sort of thing.
Well, you've got me convinced. This meeting has had an enormous impact on me. It's been
fantastic.
Great. Did we miss anything? Anything else you want to leave us with?
there's just so much to talk about. I would love to talk to you for hours on end, but I think we've got to finish up.
Well, it's been great. It's been great meeting you. It's been great spending this time together. And thank you for your story. It's wonderful.
Thanks for the platform.
All right.
Great.